Welcome to the Medical Sales Accelerator Podcast. I'm Zed Williamson.
And I'm Clark Wiederhold.
This podcast exists to put scale to the value you get from those great one-to-one conversations you normally find at sales meetings and conferences.
You've got a great idea. You see a hole where technology can make an improvement. If you build a company, the customers will come. Or will they?
And that's why we're speaking with our guest today, Dr. Keith Matheny, founder of Septum Solutions, US ENT Partners, Sleep Vigil, and more. He's also the managing partner and head and neck surgeon at Collin County ENT. His vision is to advance the otolaryngology specialty via improvement of patient care, optimizing the business of providing that care, and to contribute to technological innovation. Keith, thank you so much for joining us today.
Thank you, Zed. Thank you, Clark. You guys should be in marketing with an introduction like that. It makes me sound pretty good.
Appreciate it.
Nice. Dr. Matheny, Keith, thank you for joining us. We've known each other for a while, and it's been fun to watch you build quite a few organizations, while you've been a practicing ENT. You've been seeing patients, you've been doing surgery this entire time while building companies and bringing some technology to the marketplace. What has that lens given you a perspective in terms of the way medical technology interacts with physicians and vice versa?
Yeah, thank you. It's just been so fun. And I think the direct answer is it's maybe given me some common sense on what technology, what idea should be pursued and developed, and ones that, while they sound great, they're just not pragmatic to actually pursue and bring from the physician to the patient. Silicon Valley and other med tech hubs are littered with those kind of companies. And so I think now that I have all this gray hair and have been at this 15 years plus, I have a better sense on what makes sense and what just isn't practical.
It sounds like you're saying keep the end user in mind from the very beginning and be very realistic about how something will or will not be used. Am I off base?
No, 100%, Clark. That's a great way to phrase it. And the end user may have different faces. So we always think of the patient, which is the most important. What would this new service, technology, device, drug bring to patient care? But the end user also is the physician. Is this something that is easy to use for them? The end user can be the payer, right? Who's paying the bill? In American healthcare, it's almost never the patient, right? It's some intermediary, whether it's Medicare, Medicaid, or some private payer. So are they going to pay for it? And how are they going to pay for it? And why would they? What value does this new idea bring them? Them being the patient, the physician, and the payer. And all those boxes have to be checked before you get off Steve Jobs' proverbial whiteboard, right? So no matter how cool the device is, or the idea, I should say, if it can't be used, if there's not a clear path to being used in patient care, it's just a fool's errand, in my opinion. And I've seen that time and time again. And people, ask my opinion. Well, what do you think about this? And how can I bring this to the marketplace? And so a lot of time and energy up front, redirecting and fine tuning the idea can really save a lot of consternation later.
Fail fast, right?
Fail fast. Yeah.
Yeah.
And inexpensively.
There you go. You mentioned reimbursement and will things get paid for? So I've had discussions with folks that had amazing ideas as well. They were early in their process. And the general reaction was typically, well, this is going to get coverage. It's going to get paid for. There's so much value it brings. Now, they've got curse of knowledge happening. They've got a lot of biases kicking in that are making them blind to probably pitfalls that they're going to run into. What have you learned along the way, and how does somebody evaluate whether or not the regulators are going to actually pay for something?
Yeah, it's a great question. I don't know the time, but I know there used to be a time where the finish line was getting regulatory approval. right? And the payers were very quick to cover new procedures, new technology, new drugs. But in my 20 plus year career, that has never been the case. The finish line is actually years after FDA approval or whatever regulatory authority. And so business planning has to be done for that time when this new technology is not covered by third-party payers, when the patients may be doing cash pay, when the physicians and their staff may be fighting with the insurance companies, the payers, using unlisted procedural codes and explaining case by case the value here and getting prior authorizations. I think certainly those that are not healthcare providers but are innovating in healthcare sometimes underestimate how much work it is for the provider at no remuneration, and their staff too, to work on new procedures for 3-5 years to get a CPT code, for example, or to get a drug on formulary. And so that absolutely has to be planned for way ahead of time. But even then, as we all do, we have our own biases, especially if things are our own ideas, and we just can't see that our baby is ugly.
Mm-hmm.
And so we always need to surround ourselves with great teams of people who are honest, constructive, not just jerks about it, but honest, and say, well, here are the flaws here. And included in that, one flaw might be, well, is this just a slightly better mousetrap? If so, why in the world would a third-party payer or a patient pay more for this when something is pretty good already? And so all of those questions, I think those are more important than even the actual technological questions. Developing the technology is, should we do this? It's not can we, it's should we do this?
Yeah, there's a cold, harsh reality that there are a lot of great pieces of technology, really good ideas that are dead along the road to awesome medical device companies.
And
Execution,
especially if
funding, cash
if it's
burn,
all predicated on reimbursement that you assume will be there, right? We have several technologies in the ENT space currently and historically that was kind of assumed, oh, this will be easily reimbursed, and it wasn't. And still struggling. Some technologies have been around 10-15 years that are good technologies, but still don't have full market access.
When we look at this, and let's pretend, hey, this might be hard, but let's pretend we're doctors looking at this for actually root cause, and we're treating this as an illness within the industry. What are these the symptoms of? Why do we come across scenarios where devices get over-engineered, and then when they get in the hands of surgeons, the surgeon goes, nah. And then why do we get to this place where a company can spend a decade and millions, hundreds of millions of dollars, and it's really just a slightly better mousetrap? If those are the symptoms, what is that root cause?
That's a great question. And all the times I've been fortunate to talk on this topic, that's never been asked, Ed. And immediately coming to mind is fragmentation. Okay, so I went to school. I'm young for my age, so I went to school though till I was 32. I never had 3 credit hours of business. I had no remote idea, upon graduating from fantastic institutions, how to bill an insurance company, what a code would be. I knew how to do all kinds of elaborate surgery, and I knew how to dictate about it and all the research behind it. I knew how to conduct research and all those things. I had no idea what went into the technology that I was using, or the procedures, or the drugs. By the same token, what I discovered early on when I would volunteer my time and work with companies developing new stuff, they have no idea what it's like to be a provider. What the engineers think is the coolest thing ever and will be so widely adopted, well, the physicians often don't. And I've seen that disconnect so many times. And then you have, the payers who are just, looking at the bottom line, and they don't care as long as, patients are somewhat getting treated. I mean, they care about their patients, of course, the insured lives. At minimum, they care just for their own outcomes and to contain their costs, but they don't look at it like a physician does, and they certainly don't look at it like a developing company does. So fragmentation. So what I've found, and this is true probably in life in general, the best solution to this root cause is collaboration. And so in the companies that I am building and have built, we try to incorporate everybody. And I think that's the thing I'm most proud of where I sit in my career now, is wearing all these different hats. I can hopefully see from each person's perspective and bring that collective wisdom into whatever endeavor we're doing at the moment.
Yeah, that actually makes so much sense. What's funny is you just reminded me of my uncle, because I remember as a kid, he was in this big contracting company, and he spent so much of his time fixing the screw ups of these fancy architectural firms, because they designed something that would be beautiful, but it just could never be used by a human.
Yeah, not
and
functional.
it's the same thing. And so
Yeah.
that really makes so much sense.
Yeah. And, the way there's further fragmentation too, so my naivete, when I first met you guys 10, 12, 15 years ago, and I was taking my proverbial cocktail napkins, I was shopping it around to large multinational corporations thinking, oh, well, they can just develop this as a, pet project, and 3 or 6 months we'll have FDA approval and be using it. And that's how naive I was just a relatively short time ago. And so the fragmentation is such where no, the large companies in the ENT space, in every space, they don't develop new ideas, right? They pay the people that did. And then where the large companies are so good is they're able to scale that up and bring it to the masses, whereas small companies cannot do that. My largest device company, I have a couple, we're working our butts off to develop 10 markets, and that's about all we can do. But someday, hopefully, if we exit to one of the strategics, they can, within a quarter, take it to 250 markets with their existing sales force and their presence. And so the fragmentation goes on, right? And what I hope is to be one of many vehicles for more collaboration. I still think of the physician labs that I have done at medical meetings, and they pay you a little bit of money to go play with new technology for an hour. And I remember the engineers so many times, just they're so excited to see what the doctors think of something, and everyone goes in there and goes, meh, that's okay, or that's the same as what I have now, or that's actually worse. And it's just because neither party has any communication before that point.
What's also funny is there's a difference between someone who's excited to see what they think compared to the person who's excited to learn what they need to change. Because that person who is excited to see what you think then becomes not excited when you don't like their baby, and they put themselves in a defensive position, right?
Yeah, they just want validation instead of truly making the product better, right?
Yeah.
Yeah, so receiving critical feedback without defensiveness, right? Recognizing that that's actually solid gold that will help you down the road. Yeah, great point.
Man, I don't care. Everyone who just heard that sentence, I don't care what role you're in, whether it's in engineering, sales, leadership, that it is solid gold no matter what role you're in. And our brains are built to pretend it's harmful. And so the more we can realize that feedback is solid gold, the better.
Well, I know your organization and ones I try to build, I think if my colleagues at the various companies were here, they would say the same, is we have weekly or more frequently than that accountability meetings. And more often than not, I'll start it off with, this is a safe place for us to say the icky stuff, right? I mean, we don't need to sit around and slap each other on the back for good things. Everybody knows those, and there are so many successes. This needs to be a safe place to say the tough things, and what are we going to do about it, and not hide that. Yeah, so you're right, Zed. I mean, that should pervade any organization, but certainly as it applies to new healthcare technology.
As you gain a broader perspective of what happens on the device and technology side, and just building organizations, getting things through approval, working through funding, whether it's friends and family or other sources, what perspective changed for you from I say simply, right, but simply being the practitioner, right, the one using the tools that were coming to you from other places?
Yeah, it was very gradual. I just, I did a very prescribed path. I majored in biology. I used the same exact textbooks when I got to medical school, took the same classes over. I'm jealous of my daughters. Both of them are in college now, and one is pre-med actually. And they're just the breadth of other courses that they're taking, especially the business courses that I wish I would have had, right? Since I was going to learn the biochemistry and physiology anyway. So, just thinking about that. But after my career and starting in those 1 hour sessions at meetings, and even as a resident still, doing anything you could to go to a nice steakhouse, when you're making $2 or $3 an hour, and the companies want your opinion as a resident, I really discovered the passion for new technology. And still, for another additional decade, never fancied myself doing any of that. But just step by step, I've just been so fortunate, and there's been so much serendipity in my career. And for the most part, people have treated me so ethically and honestly too, and not ripped off my ideas. There's a few exceptions, but for the most part. And finally, I recognize, hey, there's some ideas that I'd like to develop too, that I think are unique, that would really help myself and my colleagues in patient care. And so I keep going back to that. In fact, those of you like you two that know me well know I wrestle with the balance of being as involved in these companies as I want to be, that I feel like I need to be, but still being very vibrant in my patient care. It's very difficult to overlay and juggle that. But I feel like my ancillary roles in these other companies, I would not nearly be as effective, or I would lose a lot of the common sense, I guess, if I'm not still touching patients and practicing within the business of healthcare and how that evolves seemingly quarterly, interfacing with payers and hospital systems. So that's kind of a long answer, Clark, to that. Is just step by step and gradual, and just uncovering passions that I didn't even know were there, and then going for it.
Is there a perspective that you have on dealing with industry now that's different than you had before starting these organizations, on the, let's say, the vendors or the actual companies that you deal with in your day-to-day practice?
Yeah, that's a great question. All of these are just new concepts. It's really fun to think about it. I think it's kind of the Wizard of Oz, right? I probably thought, certainly as a resident and an early community practice physician, just thought these companies really knew what they were doing, and really everything was clear. And so getting to know many of these leaders personally, people that have been to my house, I've been to their house, we know each other's kids now. You recognize, no, we're all really working to figure it out, and making educated guesses, and getting up when we were knocked down, and failing and failing and failing, but learning each time, receiving critical feedback that keeps coming back up. So I'm more impressed with these individuals now that I really know them, than just automatons that never made mistakes and just knew what they were doing right out of MBA school. And I'm sure it's true in other specialties, but I think we're really fortunate within otolaryngology to have amazing people. Our sales professionals at several different companies are just so high caliber. The leadership at the company is so high caliber. And as a rule, ENT physicians too are just cool people. They're, I think they keep things in perspective. They earn a good living, but they almost to a person have outside interests, and very family oriented. I love the specialty. Obviously, I'm biased. That's what I picked. But even 27 years after making that choice, I really am happy with that choice, and cautiously, gently guiding my daughter to make the same choice. Just because it's compared to other, I guess equal income levels and stuff. The lifestyle is just so great, and the fact that we have 7 specialties really just related by anatomy of the head and neck, but 7 very different things. There's always variety, and you can really tailor things to what you want to do. So I made a good choice as a young kid to choose ENT, and that continues to be something I enjoy today.
There are a lot of hats that somebody needs to wear when they're a founder and they're starting and then getting people to buy into a vision and even just working on a prototype, much less other, types of organizations like creating a GPO and businesses like that you have also created and started from the ground up. So I'm willing to bet there are some things you didn't expect that came to be true after you started those organizations. What were some of the surprises, or what was one of the largest surprises that you've witnessed that you didn't see coming down the pipe? Is it, trouble funding or getting people to buy into the pitch deck of, the value? What could you share with the audience?
Yeah. I think the time, every step just has taken so much longer than I ever dreamed.
Yeah.
Again, I put that on myself and naivete. But yeah, when so many, I just talked about how creative and brilliant most ENT physicians are. I'm not special. Everybody has fantastic ideas. So I think perseverance is the key, tenacity. Every one of these, USENT, for example, that really started in 2007. We're recording this in 2023.
Yeah.
And it's humming along now, but really just over the last couple of years. The device company ideas and the foundation of all the patents I'm fortunate to have now, those came around 2011. So even that's 12 or 13 years ago. And so I think that's what shocked me, Clark, is how each step has taken so much longer. And then you touched on it, just the general skepticism that you have to push through. Taking the GPO as an example, not that this is a commercial for that, but just to illustrate your point. We've built a company that it's very easy for physicians to join and to benefit from. It is a large buying group like Costco or Sam's Club. And the way we've structured it, we have relationships with 30 or 40 different suppliers, trackable included. And practices can just interface with those that they choose. There's no catch. There's no membership fee. You just join us and we benefit by getting bigger so we can interface more effectively with the suppliers. But that's all we really get out of it from the physician. And there's still so much skepticism. Well, there's got to be a catch, or why? I don't want to be hemmed in. And so there's skepticism about that. There's skepticism when you do seek funding. Certainly as a physician, I have to deal with a lot of prejudice and bias. Like, well, you're still hanging around and you're still in charge of things. Why didn't you turn it over to the business people, 5-6 years ago? And I'm fortunate that the business people are working right with me, and they have given me on the job training and MBA, it seems like. So there's those kind of things that I didn't anticipate, because going through school, people that are ENT physicians, were always the top of the class and received all the accolades. And so to meet those kind of headwinds when I deviated from the prescribed path, that surprised me a little bit too. But made me better. The critical feedback, right, is always an opportunity for us to get better. But overall, I don't want to sound negative, because I love it. I mean, I have so much fun. I have fun talking about this stuff for a few minutes because anybody can do it. I've just been foolish enough or tenacious enough to hang around long enough to see some things pay off, you know.
It's the story of the 15-year overnight success.
Yeah.
Right.
Yeah.
It's
Every
so
overnight
common.
success started about 15 years ago. Yeah.
Uh,
24/7, right?
Yep,
For
exactly.
15 years. Yeah.
Keith, I really appreciate you taking the time and spending with us today. These are great nuggets. I love some of the things you pointed out about fragmentation, the importance of tenacity. If people want to learn more or connect with you, what's the best thing for them to do?
Yeah. I welcome it. I love being available, as so many people have been available for me. So probably the best way, the most direct way, is to reach out on LinkedIn. So my personal LinkedIn profile, I'm very active on there with messaging. And then, of course, through my practice, which is Collin County Ear, Nose, and Throat in Frisco, Texas, North Dallas, either one of those.
Right.
So I
We'll put
welcome
links
it.
to those in the show notes so people have easy access.
Great.
And listeners, visit medicalsalesaccelerator.com. When you do so, you can sign up for emails so you learn about new episodes as they're coming out. You can also download a resource that helps you engage better with your customers. And lastly, you can suggest topics or guests for upcoming episodes.
If you found value in today's episode, do me a favor. Go to your phone where you're listening, hit subscribe to the podcast, leave some stars, give us a review, and share it with everybody you know, your friends, your family, your mama and your daddy. We greatly appreciate it.
Thank you, Clark. Thank you, Zed. Take care.